Hello everyone, welcome to sqadia.com. I am your educator Dr. Lara Munir. Throughout the previous lectures, we have been going through the hematology section of the internal medicine course. We went through a lot of topics and today is a continuation of that series. In the previous lecture, we started to talk about the plasma cell disorders. We defined the plasma cell disorders, what are the special characteristics to this group of disorders, what are the various types of plasma cell disorders, and then in the latter part of the lecture, we talked about some rare presentations or the rare types of plasma cell disorders like the Waldenstone microglobulinemia or the heavy chain diseases. Our topic of discussion today is multiple myeloma. Multiple myeloma is the major presenting disorder in the group of disorders which are termed under the umbrella of the plasma cell disorder. So multiple myeloma is the classical disorder which presents with the signs and symptoms common to most of the plasma cell disorders. Now, before going into the details, let's talk about the basics. Multiple myeloma basically can be defined as the clonal proliferation of neoplastic plasma cells. So since this definition describes that this is a clonal proliferation, only one clone of plasma cells is the one which is proliferating and giving rise to the antibodies. So you can term it that it is a malignancy of plasma cells. Multiple myeloma is one of the common hematological malignancies, especially in males in population as compared to the females. In males, it is more common among the African American males as compared to the white population. The mean age of presentation is around 65 to 70 years of age, and it has roughly about 1 to 2 years survival period if it is undiagnosed or untreated. So you can think of it as a very aggressive malignancy. There are certain classical signs and symptoms of multiple myeloma which differentiate it from the other plasma cell disorders. First of all, you have to see that on histological presentation, how do the plasma cells look? This is a slide of a presentation of the peripheral blood film. Here you can see that this is a plasma cell and it has a peripheral nucleus with a perinuclear halo and a basophilic cytoplasm. Along with that, there is a cloak-like chromatin pattern. When we are going to talk about the histology in the further coming slides, we are going to discuss it in further details. But a plasma cell basically is a proliferation of the B cells, B lymphocytes. So the plasma cell gives rise to antibodies, and those antibodies are important for the humoral immunity. When there is a clonal proliferation of plasma cells, as it is in multiple myeloma, one of the types of antibodies, most commonly the IgG or IgG-A, it is being hyperproduced, and the other types of antibodies are suppressed. So despite being in excess of antibodies, the body is in a state of immunodeficiency. The reason being that most of the other antibodies are being suppressed, and on the other hand, the clonically proliferated cell, the plasma cell which gives rise to the antibodies, those antibodies are not effective in performing their job. They are basically ineffective antibodies. They are the neoplastic cells. So they can't perform the function of the humoral immunity. So because of that, a lot of signs and symptoms of plasma cell disorders exist. The major salient features of this disorder, which are going to be the hallmark of and which are going to help us in diagnosing this disease, are number one, the patients will present with bone pains or the bone fractures. This is because of the lytic lesions of the bones, and the reason being, which we are going to discuss in the pathogenesis, is because of excess activation of the osteoclast, and there is no activation of the osteoblast. So because of an osteoclast activation, the bone lysis starts and the bones start to break down. This is especially present in the bones in the back of the, for example, the vertebrae, in the bones in the chest, for example, in the ribs, and then in the sternum. So this patient presents with bone pain, or in advanced lesions, the patient can also present with a fracture of the bone. Along with that, another hallmark of plasma cell of multiple myeloma is renal problems. Basically, 50% of the patients, they have some renal issue, and most commonly, a lot of them over the period of years can develop renal failure. So renal abnormalities along with the bone pains can give us a clue of the patient having multiple myeloma. Similarly, because of the defective antibodies being produced and the other antibodies being suppressed, the patient is susceptible to infections. We're going to see in the coming slides in the clinical features what are the kinds of infections that the patients most commonly encounter. But about 50 to 60% of the patients with multiple myeloma present with one infection or the other in their course of disease. The patient will present with normocytic normochromic anemia. Along with that, hypercalcemia is a very classical presentation of multiple myeloma. Hypercalcemia is partly because of the bone lysis. As you know, that the bone is primarily made of two parts. It's an osseous component of the bone, which is basically the extracellular matrix, and along with that, the mineral component. So once the bone is broken down, the calcium is being released into the circulation, and that hypercalcemia itself can give rise to a lot of problems. So these four classical signs and symptoms: bone pains, the renal failure, infection susceptibility, anemia, and hypercalcemia. These are the ones which are the hallmark of multiple myeloma. In fact, we have a small mnemonic to remember all these signs and symptoms. The mnemonic is CRAB, C-R-A-B. The C stands for hypercalcemia, R stands for renal abnormalities, A stands for anemia, and B stands for bone pains, or you can say, or bacterial infections as well. You can remember both of them with the help of B. So this CRAB mnemonic helps us in remembering the main signs and symptoms, and this is the mnemonic that we use to first tick off all the signs and symptoms, because all of them need to be present for us to have a diagnosis of multiple myeloma. We are going to see the certain criteria in the coming slides when we are going to talk about in the diagnosis. How do we differentiate MGUS or Waldenstone macroglobulinemia or other types of plasmacytomas for classical multiple myeloma? It is because of these signs and symptoms and these classical presentations. Along with that, certain types of rare abnormalities can also present in the if the patient is presenting over a long period of time. Clotting abnormalities can be present. The patient might have a bleeding tendency. This is because the antibodies might interfere with the clotting factors or with the platelet adhesion to the endothelium. Similarly, certain types of neurological symptoms. This neurological symptoms in the patient with multiple myeloma is majorly because of hypercalcemia. Otherwise, in patients presenting with Waldenstone macroglobulinemia, hyperviscosity was the major sign presenting complaint, and hyperviscosity was the reason that led to the neurologic symptoms. On the other hand, in patients with multiple myeloma, generally IgG or IgA are the major antibodies which are being overproduced. They are not very big antibodies. That's why hyperviscosity is very rare. In a variant of multiple myeloma, which is a very low percentage, if the IgM is the major antibody which is being overproduced, then we can have an overlapping picture of Waldenstone macroglobulinemia and multiple myeloma, in which hyperviscosity will be present, and that hyperviscosity can lead to the neurological symptoms like the headache, blurring of the vision, vertigo, dizziness. So the manifestations of hyperviscosity will be present in IgM variant of multiple myeloma, or it is majorly a manifestation of the Waldenstone macroglobulinemia. So this differentiation, demarcation is the one which you should always keep in mind when we are talking about the various types of plasma cell disorders.